spleen. You can take a picture whenever you want. This is his stomach, and this is the start of his stomach. You can see it's here. The wall of the stomach is thick. It's this thick.
Wow, it's not supposed to be like that?
No, it's supposed to be like this right here, where it's this thin.
He's supposed to have a gap.
He's not supposed to have. This is a gap right here, and that's all probably tumor involvement right there.
Wow.
And you can take a video of this if you want. That'll work fine. But it's very distended. This is the day he came in. It's this big. It's supposed to be like that. It's just swollen because the loops or bowel are putting back pressure back on his abdomen. This is the omental disease. So all this stuff right here, the omentum, the fat layer is supposed to look like water, which is black. But all this stuff right here is omental disease. All this stuff right here, it's tumor in the fat of the abdomen.
What's the abdomen again?
The stomach.
This is the whole abdomen, right?
Okay.
Right. So there's normally fat in there, and so the bowels are able to move right through through the fat. All this disease right here. This is fluid here.
It's not in one spot. Is it normally
It's not.
in one spot?
No.
It's all over.
Right. All these little freckled spots, speckled spots right here. All this stuff right here, and these are where it's strangulating the bowel. You see, it's kind of pinching off the bowel right here. It's supposed to kind of look like a nice, straight line.
Like a river.
Right, and it's cut off here, cut off here, cut off here, cut off here. Do you see that?
So that's the reason he can't process the food?
Right. So it's being strangulated, basically. All this disease right here. This is all cancer right here. All that's the...
It shouldn't all of these?
Yes. Chemotherapy will work anywhere from below the brain all the way down to his toes. It doesn't get crossed into the brain barrier, but we don't need it there because there's no spots in the brain. It's right down here. So this is all a mental carcinomatosis, all these little nodules you can see here. So a lot of that. I'm not a radiologist, so you can take it for a grain of salt. I'm just trying my best. This is all a mental carcinomatosis. Here's what is called air fluid loops. So the bowel is kind of pinched off again, and there's air in the bowel and there's fluid in the bowel, and it's just not moving basically very well. Yeah, it's kind of trapped.
When they took the fluid, he feel better.
Right. Okay. And you want to see any other pictures on that, or that's about it though. That's pretty much all I can show you because I'm not a radiologist.
So how many chances you have with the chemo?
Can I shut this off real quick? Is that okay? Okay. How many chances does he have? Oh, this is a tumor marker if you want to look at this. So his tumor marker CA125 is 257. And that's just a marker of, here it is right here. Okay, 257. Normal 0 to 30 or so. And that's just a marker of peritoneal or abdominal disease, basically. How many chances does he have with the chemotherapy?
What are his chances?
What are his chances? The chances of the chemotherapy responding are anywhere from, depending on which studies you look at, from 30 to 60%. So it's not a home run that we're going to be able to shrink everything down and make everything go away. Unfortunately, we're not sophisticated enough to predict exactly what his chances are. These are just from studies that have been in the past. So that's his chances of responding. How many chances does he have? Like, he has infinite amount of chances if he stays fit and is able to tolerate treatment, etc. What happens is when patients get one cycle of chemotherapy and get a couple more cycles and they don't do well, they don't eat and get nourished, they start to get weaker. And then at some point, if the cancer spreads and causes other problems, and it gets weaker, and then at some point we're unable to treat those patients because they're too weak to tolerate treatment.
So basically, eat right.
Right. So, this is a really make or break situation right now. Right now, it's kind of the point in time where we don't want to screw up. Because if you take too much time and the cancer grows on an exponential growth curve. It kind of grows for a while. It could have been there for 12 months, could have been there for 6 months. It's impossible to say. It grows for a while and starts to pick up. And right now, it's somewhere on this part of the growth curve. We don't want to wait till it's here because there's no way to get it back down at that point. Yeah, I don't want to say these things in front of in the room with him, but this is a very, very serious and fatal situation. It's extremely serious. It's stage 4. And in that paperwork, I've given some patient information from the Cancer Institute. It talks about it, so you can see here, and it talks about staging. So stage 4, basically talks about spread anywhere distant parts of the body outside the stomach. So this is stage 3 when it's in the stomach. When it's in the outside of the stomach, it's called stage 4. You can see here stage 4 treatment is not surgery. I say treatment for stage 4 is chemotherapy. That's what they talk about. Surgery as palliative to stop the bleeding or shrink the tumor that's blocking the stomach.
Have you ever seen the stage 4 come down to the lower stage?
Oh, absolutely. I was just telling him that
on
we
its
had.
own?
No.
You've never seen it?
Never.
Never see one.
Never.
Stage 4 go down on its own.
Never. I mean, people will tell you. I mean, you have to be very careful, okay? Because cancer is a difficult situation. People are going to tell you everything. Oh, take this herb, take this supplement. Don't trust the doctors. They don't want to cure the cancer because they don't study these supplements, and it's all lies, basically, because we've spent about $3 billion on studying supplements and vitamins on
Do you give any
cancer.
supplements, vitamins here?
We do outpatient. They don't do any in the hospital, but once he's doing better, we do talk about that. But none of that stuff is effective in beating the cancer. None. There's zero evidence that stuff works. So this is what works. This is why nobody will pay for it. If you get a supplement, you have to pay cash for it. Why is that? Because it doesn't work. Insurance doesn't cover it. Like if you go say, I want to take some vitamin C, I have a cold. You ask your doctor to write a prescription for it. There's no prescription for that because it doesn't work. I want to take vitamin E. Well, vitamin E causes cancer. So, we can wait however long you want to feel comfortable. No one's going to rush you into this decision. But as I said before, you can see how extensive the tumor is in his abdomen. For it to get better on its own is going to be very difficult. And
You mentioned something about 30 to 60% chance. Can you explain all that again?
yeah, so there's about 30-60% chance that chemotherapy is going to shrink down the tumor. You okay?
So there's another percent that it's not going to work, right? The
About
percentage.
40 to 70% chance.
Yeah.
I mean, if you want to make it simple, hi, Roger, right? Nice to meet you. It's about a 50-50% shot.
Yeah.
And I wish, in other cancers like lymphoma, 100% sometimes, chance of response. This is a very difficult cancer, very difficult.
Advanced.
It's advanced. I mean, it's all throughout his abdomen.
Wow.
So, this is no. I'm saying lymphomas are of 100% chance of responding to chemotherapy, but this is gastric cancer, unfortunately.
Is it in his lymph nodes of the stomach?
There's no lymph nodes inside your stomach,
Outside.
but there's some lymph nodes outside the stomach, and it looks like some of them are on monitors, but really it's kind of a moot point because it's already past that stage. Your cancer kind of moves to the lymph nodes
So
first.
it is in the lymph nodes.
Yeah.
What is that?
No, lymph node cancer just moves in a kind of a reverse highway to lymph nodes first and then out. So there's some lymph nodes enlarged on this CAT scan. It doesn't really matter at this point. The end game is it's all throughout his abdomen and it's blocking his intestines in multiple spots. This information that you're going to read, so I give you a copy of it. Here you go. Is what I'd like you to read through. Okay. We can easily wait to the weekend. It's not a big deal. Okay. You can ask whoever you want, talk to whoever you want, and we can go from there. Okay. I want him to get the best treatment humanly possible, and that's what we're going to offer him. Okay.
Man.
If there was something better out there, I'd say, look, let's do this. Let's get this treatment in Alaska. Let's go for it. But there's clearly not. I'm giving you those national guidelines that I gave you are the 2013 national guidelines. There's nothing more up to date than that. It's printed out today, like 10 minutes ago. So that's what we're trying to offer him is the most current treatment possible, the one he's going to tolerate and do well on. What I'll do is I'll hold off writing the chemotherapy because I don't want to give it, you guys are going to take today to write it. I don't want to give chemotherapy on the weekend when no one's here and it's a big mess. So I'm going to wait until Monday. Think about it. Yeah, think about it, talk about it. Monday morning I'll be by if you guys want to, get ready and sign the consents, you can do that over the weekend. We'll get, a PICC line placed, so everything's teed up and ready to go for. We're going to put the PICC line in regardless. PICC line is like an IV, but it's just one for chemotherapy, and we can pull it out. If he decides no, he doesn't want chemotherapy, or you guys don't want chemotherapy, you can easily just pull it out. So right now, just to summarize, there's only one treatment course. It is medical. Radiation or surgery is not going to help, and it's either chemotherapy or clinical trial. The standard chemotherapy your options are on that page. I think this is the most tolerable. This is the exact same treatment that Anderson gives, because I was trained there, and that's why I'm biased in those from that standpoint. Clinical trial is the other option. He would not meet criteria to fit into any clinical trial.
What is the recovery time?
From the chemotherapy, it's about 5 to 10 days, but he's in a difficult spot right now. So it's impossible for me to predict that, because I don't know if his bowels are going to open up. He's going to start to eat over the weekend. He might recover 3 days.
How long does chemotherapy take?
A couple hours.
Oh.
Mm-hmm. It's pretty quick. It's once every 2 weeks to 3 weeks.
And how long is that?
Indefinitely, until he, it depends on
It
if
could
he's
take months,
tolerating.
a
It could
year.
take months,
It's
yeah.
like once, twice.
He asked me a good important question when you weren't here, and I want to ask if you're okay with hearing it or not. I hate to tell you standing up. Is this okay if I talk to you? Okay. He asked me about life expectancy, and that's a very important question. Do you want to hear that now, or do you want to just wait on that? It's not going to influence
The
your
5
decision.
year survival rate?
I need to.
No.
He asked me kind of overall survival, how long they live, which is kind of more important. You don't want to hear that, yeah. I don't think it matters right now. It doesn't affect what treatment we're going to do. It doesn't affect anything, but I will tell you, untreated, the survival is not very long. And so, that being said,
So
if
it can open up at any moment right now?
yeah, I mean, let's say his bowel opens up, which is great, which is what we're hoping for.
But the cancer's still there.
The cancer's still there.
The-
It's still
you said
growing.
The tumor, you want it to open, is that what you were saying?
Right, I wanted to kill the tumor, so there's less chance of blocking the intestines.
So he can eat more, so he can use the breast be more normal, but the cancer's still there.
Right. So if the bowel opens up without chemotherapy, it doesn't mean that the cancer is not still growing. Is what I'm saying. It's fine. I mean, I think you should, because I can sense a lot of apprehension. So I do want you guys to think about it, do your due diligence, and then get back to us and go from there. Okay.
Okay. Thank
You
you.
guys have a great day. Okay. I'm sorry to break this news. We'll do whatever it takes to try to get him better. Okay.
Thank you.
All right. Thank you guys. Have a great day.
Thank you.